And we're going to turn now to news back here at home in the coronavirus pandemic. Tonight, more than 1 in 3 Americans have at least one COVID shot, and more than 1 in 5 are fully vaccinated. Many Americans now have questions about the Johnson & Johnson shot after a very small percentage had adverse reactions. Here's CBS's Nikki Battiste now with what you need to know.
Johnson & Johnson's vaccine facing a double dose of problems. Georgia, the third state to temporarily shut down a site after 8 suffered adverse reactions to the J&J vaccine. In North Carolina, 18 people reporting side effects. In Colorado, 11 reacting to the shot with symptoms ranging from dizziness, nausea, and fainting.
This is, a really potent vaccine. And what we're seeing is some of those potency relating in a very rare side effect that we just have to be aware of.
In fact, all 3 major U.S. vaccines produced adverse reactions in more than 60,000 people nationwide, except that for each manufacturer, including J&J, just 0.1% of all people have reported side effects. Another problem, distribution. The company dramatically scaling back shipments next week. In Michigan, dreadful deja vu. Some hospital ICUs once again nearing capacity.
Lives depend on it. Michigan is unquestionably a national hotspot right now.
The state's governor asking for a 2-week pause on indoor dining, in-person learning, and youth sports, a driving factor in new cases among kids. Pfizer is now the first company to seek emergency use authorization to give its vaccine to children as young as 12. Confusion in California. Those running one site with extra doses telling people to show up. Thousands did. Most turned away. In New York City, variants making up nearly 80% of new daily cases. Almost half are homegrown. Another 30% driven by the UK variant, which is believed to be up to 70% more contagious and more lethal.
Given the UK variant really dominating in the US, how effective still are the vaccines?
The current vaccines that are out there in the public work against all of the variants. The American public should rest assured that science is pivoting along with our knowledge to be able to take care of this. And the benefits of the vaccine tremendously outweigh any potential downside.
Here at Lenox Health Greenwich Village, about 1,300 people a day are receiving a dose of Pfizer. Dr. Eggis told me side effects from any vaccine are normal and people should not panic. Norah?
Nikki Battiste, thank you.